team. And with us today, Kevin Earley, who from a very personal perspective has had that personal experience as someone with a mental health challenge who has interacted with the law enforcement system, and his perspective is critical to reminding us that this is about real people. Kevin.
My name is Kevin Earley, and I live successfully with bipolar disorder. I've been on medication for 9 years, and I've not had a single hospitalization or episode in that time. I've also worked with Fairfax County with the CSB for the past 6 years as a peer support specialist, and I love my job because I get to help people like me transform their lives for the better. I'm here to tell you that Diversion First works. It can save money, it can save time, and more importantly, it can save lives. I know because I have been both a recipient and a provider of jail diversion services. I know because a jail diversion program has saved my life. I know firsthand that recovery for people living with mental illness is possible because I am proof that it is. When I was at my worst, I was very sick and psychotic, and I needed help. I was a young man, and I was paranoid and desperate, and due to my illness, I broke the law and endangered myself. At one point, I was even tasered in an incident with police. It was a low moment and an example of how hard it can be for individuals with mental illness to get proper treatment. I know that I am lucky, I know that I am fortunate, because eventually I was linked up with an incredible case manager who cared about me and my well-being, and she saw potential in me even when I did not see it in myself. I had a great psychiatrist who met me where I was at and did not push any of his expectations onto me, but still pushed me to better myself. I had family support and friends who were there for me in my darkest hours. I was sick and I needed help, not jail time. I needed support, not stigma or judgment. Fortunately, I've been able to thrive with help from my case manager, my family and friends, my treatment team, and the Community Services Board. It should not be a crime to live with mental illness. It is a crime to not do anything to help those who are living with it. Nowadays, I help teach police and crisis intervention classes because I want both the police and the people living with mental illnesses to have a better outcome when they meet. It's easy for a situation to escalate, and I don't want anyone else to get tasered like I have been in the past or worse. The last time I was sick, in 2007, I was lucky to be approached by an officer who had been trained in crisis intervention. I explained to the officer that I was sick and I needed help, and I knew that I needed help, but I did not want to be handcuffed because I was frightened and scared of handcuffs. He sat me in the back of his squad car and drove me to the hospital. He spoke with an even tone. He was calm and listened to what I had to say, even if it was nonsensical or insane. He treated me with dignity and respect, and even asked me what radio station I wanted to listen to as we drove. It may not seem like a lot, but a small gesture such as this can mean the world to a person in a psychotic state. I joked with the officer that without the handcuffs on, it felt more like a taxi cab than a police car. And that is the point of these services, to make the ride more like a taxi than a police car heading in the direction of help. There shouldn't be a shame in having a mental illness or seeking treatment for one. Diversion First saves money, saves time, and most importantly, it saves lives. I know because it has saved mine. Thank you.